you're just tuning in, you're listening to Maximize Living Radio. I'm Dr. Alex Pattison. This morning we're talking to you and discussing with you how to get the most out of this life, how to get the most out of this body, how to express the most health in the shortest amount of time possible. What's amazing about Maximize Living and the protocols that we follow, I just had a young guy the other day. He came in, he was having horrible pain in his neck and his lower back. He had put on weight over the years, and within the first month of care, just within 30 days of evaluating his body for these 5 essentials, not only is he neck pain free, not only is he low back pain free, but he's lost 17 pounds in 1 month as a result of living this lifestyle, expressing that health, expressing that healing like he had never done before. We had another lady come into our clinic suffering from pain, debilitating pain. She'd been seeing other professionals in the healthcare field for years. She's seen other chiropractors, other nutritionists, other people helping her detox. And all the while, she was getting worse and worse and worse. Within just about the first 5 weeks of care in our clinic, the pain's going away. She's losing the weight. Her mind is becoming clearer. She's feeling healthier than she has in years. And this is all a result of not what we do in the clinic, guys. You know, what we want to do, what we all our focus is find out what's interfering with your body from healing, remove that interference so you can express that God-given healing potential to its fullest. I want to go ahead and move my discussion this morning a little bit further down the road on something that I know most of our listeners either right now or at one point in their life is dealing with, and that's low back pain. Here's a few interesting facts on low back pain. 31 million Americans are experiencing low back pain at any given time. That's 10% of the American population dealing with back pain. Low back pain is the single leading cause of disability worldwide, according to the Global Burden of Disease that was done in 2010. Back pain is one of the most common reasons for missed work. In fact, low back pain is the second most common reason for somebody visiting a doctor's office, simply outnumbered by upper respiratory infections. Nearly 1/2 of all working Americans admit to having back symptoms at least once every single year. The statisticians, the experts estimate that as much as 80% of the population will experience a back problem at any time during their lives. And most back pain, listen to this, guys, this is what the research shows. Most back pain causes are mechanical or non-organic, simply meaning they're not caused by a serious condition such as inflammatory arthritis, an infection, fracture, or cancer. After an extensive study of all available care for low back problems, the Federal Agency of Healthcare Policy and Research, which is now called the Agency for Healthcare Research and Quality, recommends that low back pain sufferers choose the most conservative care first. What does that mean? It means that spinal adjustments to the lower back, to the sacrum, to the vertebrae in the lower back, as well as the hip bones, the pelvis, are the most safe and effective drugless form of initial professional treatment for acute low back problems in adults. In fact, if an individual is hurt at work and their first point of contact is an orthopedic surgeon, they're 43% likely to be cut and to have a low back pain. If that same individual goes into a chiropractic clinic first that hurt their lower back at worst, they have a 2% chance of having low back surgery. This is the most conservative forms and at the same time the most effective means of dealing with low back pain. You want to talk about the healthcare system that's built here in the United States and how we are trillions of dollars in debt as a result of this. If 10% of Americans are dealing with low back pain at any given time, if 43% of those Americans sit down with a orthopedic surgeon and their first point of contact is a back surgery that on average is $25,000, think about the difference that we can make in American healthcare simply by getting people with low back pain to a chiropractor. We can change this world. We can pull ourselves out of trillions of dollars of debt. It's not only an amazing thing that you can be doing for your body, it's a patriotic service. It's the most effective means of decreasing lower back pain without drugs and without surgery. A well-respected review of the evidence in the Annals of Internal Medicine, one of the top journals in the world, pointed to chiropractic care as one of the major non-pharmacological therapies considered effective for acute and chronic low back pain. More recent research has shown that there is strong evidence that spinal adjustment for low back pain is effective as a combination of medical care, of exercises, and just as effective as NSAIDs, or non-steroidal anti-inflammatories for low back pain, things like Advil and Tylenol. So what I'm imploring each and every one of us to do. If you deal with low back pain either right now or it's something that chronically pops up on you throughout the year, for $40, listen to this, for just $40, we're going to do a complete orthopedic, neurological, postural evaluation of your lower back to figure out exactly what's causing your problem so that we can have a conversation of here's what you need to do in order to correct this. Here's what you need to do in order to prevent a low back surgery. Here's what you need to do in order to prevent and make sure that you don't go on an opiate or some other extremely addictive, harmful medications that are often prescribed as a result of a problem in the lower back. If you're ready to live that, if you're ready to see that happen in your life, give us a call at 412-881-4488, 412-881-4488. That number, 412-881-4488. Be sure to tune in again. God bless. Have an amazing week.